Again, I can't say enough about this is nursing's day. If you look at everything under all of Obama's agenda for healthcare reform, everything that's coming out in some of his stimulus packages, first of all, it looks like we're all going to be hardwired with electronic medical records. Well, hello, that includes clinical documentation for nurses, but most of all, it's a vehicle to help the patient through our systems. Bad things happen from the clinic to the admitting area to the hospital to rehab. Bad things happen, and electronics are going to help that. But what we're beginning to see is a shift back to kind of what happened in the early 80s when we got DRGs. Instead of getting reimbursed for this procedure at that hospital on that day and all these different clinical visits that had to be a part of that, we're going to give you, hopefully it looks like, a chunk of money to care for this chronic condition. So this brittle diabetic with chronic heart disease will get you this much money. Take care of it. And the incentives will change again. Now, it's not all
system-wide,
system-wide.
Not just acute care.
Providence. You've got every level of care. You've got everything, and we do. Take care of this person. So how much innovation is that? We know today, for example, we have a model in parts of our system called Elder Place. So this is comprehensive care for fragile elders to keep them functional and independent, and a lot of constellation of care around them. What we know about anybody who has a DRG of a chronic condition that's in Elder Place, in contrast to someone who's not, they have fewer admissions to the hospital, they are not readmitted after their hospital visit. All the right things happen to them in being an elder because of this very inexpensive infrastructure we build around. Well, today, payment in full happens if they go into the hospital. There's nobody saying, here Providence, you get this much money, take care of this person. And we know if you put a little bit of nursing around anybody in the community with a chronic condition, they'll stay out of the hospital, or when they need to go, they're prepared to go and they get out fast and they go back where they belong. But the incentives and how reimbursement happen don't necessarily reward that kind of what I think of constellation services that have to be in place so that the last place any elder is ever found is in an acute care hospital. They're in cheaper, more effective, more humane environments with support from nursing. And so if somebody says, okay, you got this 85-year-old brittle diabetic with congestive heart failure, our day is going to come and we say, great, bring it on. We will assure you that with really expert nursing case management and a lot of good care and community-based services, we can make it cheaper and better. We're seeing that more and more as we move along to doing the right thing in prevention. We've got a long way to go. But if nurses stand for anything, it's preventing bad things from happening. Illness, mistakes, whatever. So this is a time, just the CMS no pays, the things the federal government said they're not going to pay for us for anymore. 80% of them nurses could fix in a heartbeat. So again, pressure ulcers and falls during a stay, and catheter-associated urinary tract infections and central line infections and ventilator-associated pneumonia, it's all nursing. And when the federal government says, hello, we're not going to pay for you for doing bad things, nursing steps up. But we have to do it together and in the right way with an evidence base and demonstrate that with good nursing care, money gets saved and patients do better. That's our work, and that is the work of the leader, it's the work of the manager, and it has to be our entire mindset. How can we do the right thing for this patient and stop thinking about which box they're in, which is what we do today. Are they in the assisted living box, or the long-term care box, or the clinic box, or the hospital box? Who cares? Because what we knew as a hospital 30 years ago is now an ambulatory surgery center, a dialysis center, or a urgent care center. Who cares what box they're in? It's, are they getting the right care at this time of their illness, at this time of their life? And nurses know that. But we've got work to do, and it's going to take really enthused, inspired, creative, and tough leaders. We have to be tough. I had to be tough yesterday to take the heat when I canceled a meeting of a lot of really, really sophisticated clinicians. That's my work. I have to be tough. But I only have to be tough if I need to. And tough is a compassionate thing. So tough isn't bad.